Long live Cardiabcon, a society for cardiodiabetes and renal disease. I am Ashutosh Mishra. Today we'll be discussing an important topic in perioperative care, the use of glucagon-like peptide-1, GLP-1, receptor agonists, and sodium glucose cotransporter 2, SGLT-2, inhibitors. These medications are increasingly prescribed for patients with type 2 diabetes and have shown significant benefits in managing blood glucose levels and reducing cardiovascular risk. However, their use in the perioperative period poses some unique challenges that we need to address. Background on GLP-1, receptor agonists, and SGLT-2 inhibitors. GLP-1 receptor agonists, GLP-1 receptor agonists, are a class of medications that mimic the action of the incretin hormone GLP-1. They work by stimulating insulin secretion, suppressing glucagon release, slowing gastric emptying, promoting satiety. Some common GLP-1 receptor agonists include semaglutide, Ozempic, Wegovy, liraglutide, Victoza, dulaglutide, Trulicity. SGLT-2 inhibitors. SGLT-2 inhibitors work by blocking glucose reabsorption in the kidneys, leading to increased glucose excretion in urine. They offer benefits such as lowering blood glucose levels, promoting weight loss, reducing blood pressure, providing cardiovascular and renal protection. Examples of SGLT-2 inhibitors include empagliflozin, Jardiance, dapagliflozin, Farxiga, canagliflozin, Invokana. Perioperative risks and concerns. GLP-1 receptor agonists. The primary concern with GLP-1 receptor agonists in the perioperative period is the increased risk of pulmonary aspiration. This is due to delayed gastric emptying, increased risk of nausea and vomiting. However, it's important to note that the effect on gastric emptying may diminish with long-term use, 12 weeks, of these medications. SGLT-2 inhibitors. The main risk associated with SGLT-2 inhibitors in the perioperative period is euglycemic diabetic ketoacidosis, EUDKA. This condition can be particularly dangerous because blood glucose levels may be normal or only slightly elevated. It can be easily missed or misdiagnosed. It may lead to severe metabolic acidosis and other complications. Other potential risks include dehydration and electrolyte imbalances, increased risk of urinary tract infections, potential for acute kidney injury. Current recommendations. Based on the latest multidisciplinary consensus, here are the current recommendations for managing these medications in the perioperative period. GLP-1 receptor agonists. 1. Patients should continue their GLP-1 receptor agonist medications before surgery. 2. The benefits of glycemic control and cardiovascular protection outweigh the potential risks in most cases. 3. For patients on daily GLP-1 RAs, the medication should be paused on the day of the procedure. 4. For those on weekly GLP-1 RAs, it's recommended to pause for 1 week before the procedure. SGLT-2 inhibitors. 1. SGLT-2 inhibitors should be stopped 1 day prior to surgery. 2. This recommendation aims to reduce the risk of euglycemic DKA while still maintaining some of the medication's benefits. 3. For elective procedures, consider discontinuing SGLT-2 inhibitors 3 to 4 days before surgery to further minimize risks. Risk assessment and shared decision-making. A crucial aspect of perioperative management for patients on these medications is conducting thorough risk assessments and engaging in shared decision-making. This process should involve 1. Evaluating the patient's overall health status, including cardiovascular risk and renal function. 2. Assessing the type and urgency of the surgical procedure. 3. Considering the patient's glycemic control and risk of hypoglycemia. 4. Discussing the potential risks and benefits of continuing or discontinuing the medications with the patient. 5. Involving a multidisciplinary team, including the surgeon, anesthesiologist, and endocrinologist, in the decision-making process. Perioperative monitoring and management, regardless of the decision to continue or discontinue these medications, close monitoring is essential. Regular blood glucose checks. Monitoring for signs of DKA, including checking ketone levels when indicated. Ensuring adequate hydration and electrolyte balance. Being vigilant for signs of pulmonary aspiration, especially during induction of anesthesia, conclusion, and future directions. In conclusion, the perioperative management of patients on GLP-1 receptor agonists and SGLT-2 inhibitors requires a careful, individualized approach. While current recommendations provide a framework, it's crucial to remember that this is an evolving field. As we gather more evidence, guidelines may be refined further. Future research should focus on long-term effects of these medications on perioperative outcomes, optimal timing for discontinuation and resumption of therapy, strategies to mitigate risks while maintaining benefits. Thank you for your attention. I am inviting you all to Varanasi Cardiabcon on 7, 8 and 9 of March 25th. See you there. Don't forget to send your request for registration on 9554572190, 9453837595, or email us at cardiabconsociety@gmail.com.